Warm welcome to everyone. We are talking today about COVID again from a very, very interesting perspective. Alexandru and his colleague Evelyne Hübscher, they are currently summarizing and have prepared a paper from their research on how communication by politicians and experts impacted citizens' compliance during the COVID crisis. The survey experiment that they did and that Alexandru is going to tell us about in a minute had two focuses. So they looked into the UK and in Germany, focusing both on vaccination and on lockdowns, with interesting variations and variables to extract indeed whether or not there is a difference in compliance followed communication by politicians or communication by experts. And I'm very happy today to welcome Alexandru Moise, who is no alien to the EOI, because you basically went through everything that you can at the EOI, more or less. Currently, you're a research fellow at the EOI in the SOLID project. You previously were Max Weber Fellow and part-time assistant professor focusing on quantitative methods at the SPS department, and you received a PhD from the Central European University, where also Evelyne now works as a professor. And you have a very interesting spot-on focus on the politics of social policy, health policy in particular, and crisis politics, European integration, and a focus also on communication during crisis. And with that, Alexandru, the floor is yours for what will become a very, very interesting presentation. Thank you very much for being here today.
Great. Thank you so much, Gabi, and thank you for organizing and for inviting me. And thank you as well for the introduction. So I'm going to share my screen, and can you just give me a nod if you see the slides? Yeah, all good?
Yes.
Okay, great. So as Gabi was saying, this is a work that I've done with Evelyne Hübscher from Central European University. And we basically ran this study in September of 2021. And it included two survey experiments, one related more to vaccination and the other one to public health measures such as lockdowns. And what I'm going to do today is go through some of the, let's say, the interests that we had in designing the study and a few of the results. So this is still a work in progress. We're working on making this eventually into two papers, one for each focus. But I thought that for the talk today, it might be interesting to run through a couple of the results with you. So feel free to interrupt me at any point, since this will be a rather long talk. I'll try not to make it too long. But if anything's unclear, then just interrupt me and I can clarify and go on. All right, so basically I'm just going to go through kind of the aims of what we wanted to do and then the results of the two survey experiments that we had. So why did we decide to study basically trust during COVID? So we start from this very nice or not so nice quote from Jens Spahn, the former German Minister of Public Health during that period. He was talking in the context of the Omicron wave that we knew was going to hit everyone. And I guess this quote was intended to incentivize people to get vaccinated, right? The meaning behind it is that eventually, everyone is going to get the virus. So either you're going to be vaccinated, you're going to be healed, or you're going to be dead, which is very much to the point, but also very much debatable in terms of public health communication. So we got very interested in trust because we want to understand how trust impacts compliance with policies during the pandemic. We live in liberal democracies. We're not China, where we can just impose top down and force people to do what we want them to do. Everything from masks to lockdowns and vaccinations require public compliance. The public needs to agree and they need to comply with these measures. So we wanted to look at trust as a kind of important mechanism for compliance. And so in both studies, we try to look at trust in different ways. So The first study that we look at is about vaccination. So in this study, we actually tried to see whether the Green Pass policies, whether they had an effect on the uptake of the booster shot. So if you remember, the Green Pass policies were these policies giving these certificates to people who are vaccinated, and then also to people who are healed or had other or had taken a test. And in some, this allowed you to travel between EU countries, and in some countries they also imposed heavy restrictions, starting in Israel, but then adopted in most EU countries, where you couldn't enter public venues or sometimes even access your workplace if you didn't have the Green Pass. So what we wanted to know before the policy got implemented was whether this would actually have an effect on people's uptake of the booster shot. And then specifically, we also wanted to know whether this is moderated by trust in institutions. So is it that the effect of the Green Pass, is it moderated by trust? So that's the first study. The second study, we really wanted to kind of go more in depth on the impact of the messenger. So we did a survey. These are both survey experiments embedded in the same survey, wanting to see if the prime minister or an independent health expert make a difference in public perceptions of lockdown measures. So I'll go through some of the details of the exact design in a bit. So in terms of theory, I'm going to go rather briefly because I think I'm going to focus more on the results today. But basically, we look at this in a context where we have increased distrust in elites, both political elites as well as experts. And COVID was a case in point where we saw actually trust in both types of elites eroding. Sometimes we had political elites, especially populists, who wanted to erode trust in experts. You can think of Trump attacking Anthony Fauci, and there are many other examples. But politicians themselves also went through large erosion of trust during the pandemic. In this context, we know that from a lot of literature that compliance is higher with more trust. So when you trust the institutions, when you trust the government, you're more likely to comply with the measure. Vaccination is the best example here, where trust played a major role in people taking up the vaccine. They needed to trust that the vaccine was safe, delivered effectively, and so on. What we wanted to know further is not just whether trust increases compliance, but how trust operates with different groups, and how different groups would, let's say, react to either politicians or experts or to the Green Pass policy. Going into the study, we thought that the effect can really go both ways. You know, the Green Pass might encourage you or should encourage you to get the booster shot because it's going to be easier for you to access venues, but it could also generate a backlash, right? Especially if you're distrusting. And likewise with experts and politicians, there are certain types of people that are likely going to be more amenable to experts and others to politicians. So, there's been a couple of studies showing that the Green Pass has had, different effects in people, including increases in trust, but also increased in threat perception. So it made vaccinated individuals perceive that they're actually more, the threat of COVID is higher and they should take it more seriously. But we haven't seen any studies looking at specifically the impact on a vaccine uptake. So I'm going to give you, before going into the studies, I'm going to give you a bit of a context and explain the context of our study. So this graph is a bit loaded, but it'll make sense. So the first thing to look at is the black line, and this is the solid black line. So this is the number of COVID cases per 100,000 individuals. So what you see here starting in January 21, if I remember correctly, this is the Delta wave, which then ended in spring, which is when you had the start of the first vaccination wave. And then in the summer, you had the start of the Omicron wave that then continued on throughout the end of the year, throughout the year end of 2021. So that's the black line. Importantly, then these two these two vertical lines indicate the start and end of our survey. So our survey took place in the UK. You'll see Germany in a second. Took place between September and October of 2021. And a lot of our assumptions in both studies rest on the particular timing that we had for the survey. So you can see that at the time there was, in the UK, there was a relatively high caseload. The blue line then is the number of vaccinated individuals out of 100. So you see that the vaccination campaign in the UK started in February, or January, February. And by the time of our survey, we had quite a large share of individuals being vaccinated. But importantly, the booster campaign hadn't started. So that's the red line here that starts right after the beginning of our survey. So for the vaccination experiment, we actually ask individuals how likely they are to get the booster shot, if they're already vaccinated, and if they're not vaccinated, how likely they are to get the first shot. The second key point here is that in the UK, this came before, many months before they imposed the Green Pass, which was actually in December 2021. So in that sense, our subjects were untreated. They may have heard of it, but in the design itself, then we informed them exactly what this policy would be. And lastly, then we also have in the green line, we show the stringency index, which is the kind of standard measure to show the level of lockdown measures that they were going through at the time, which, as you can see, they were much more relaxed than in the first part of the year. So that's the UK. So it's a context of relatively high caseload, relatively low stringency, and happening before the booster campaign. Now, this is Germany, so the timing of the survey is the same. We rolled both surveys at the same time, but as you can see, Germany has a very different context. So the caseload in Germany was much, much lower. It started ticking up in the summer. Again, this is if I remember correctly, this is the Omicron wave, but it only really started upticking in October and November, so much later. You had a slightly lower share of Germans being vaccinated at the time, lower than in the UK. But our survey was still happening right before the start of the booster campaign. And as you can see, the booster shots picked up relatively slowly. And then only once cases started ticking up, people started taking the booster shot as well. And likewise, you see that this was a period when Germany was relaxing restrictions, at least according to the stringency index. Now, there's more of a complication here. Germany had a very complex system at the time. They had this 3G rule, which meant that you could get a kind of certificate if you were either healed, vaccinated, or had a test. This isn't exactly the Green Pass, which was also introduced. I think it's out of the graph, but it was introduced later in Germany. But this complicates Germany as a case for us because they still had exposure to something like the policy. But I'll get then later into the design. But again, kind of to summarize, in Germany, you have a lower caseload, kind of lower stringency, but also a lower vaccination rate. Okay, so then let me take you into the results of the vaccination experiment. So what we basically did, and maybe I'll just skip quickly to that, even though it's kind of a lot of text. I'm only going to show you results for the vaccinated group. So here we just asked people whether, so people who told us that they were vaccinated, we want to see what's their likelihood of getting a booster shot. So what we tell them is we give them a hypothetical scenario where there's a new variant that's spreading, and we tell them that the government is urging individuals to take a booster shot, which again is quite realistic because this was just before the booster campaign, during a new wave. But we present this as a hypothetical. So then we basically had two conditions. So the control group is the second one. So we just tell them that the government emphasizes that vaccines are safe and effective, and that they offer strong protection. So this is kind of neutral information. In the treatment group, we outline for them what the Green Pass policy is. And again, in the UK especially, this was not in effect at the time. In Germany, like I said, a version of it was in effect. So what the Green Pass policy is that this will be given to fully vaccinated individuals, and it will allow them to access several facilities and activities, indoor restaurants, bars, concerts, as well as international travel without having to test and isolate. So basically, we're just giving them this scenario, and then we want to see, does this actually impact their probability of wanting to get the booster shot? So this is just some descriptive statistics. So in our sample, kind of mimicking let's say the real world, you have a higher share of vaccinated individuals in the UK than in Germany at the time. And see, here you see the unvaccinated group. Now, for the unvaccinated group, we ran the same experiment, but instead of a booster shot, we gave them a scenario about the first vaccination. In the end, all of the results for the unvaccinated group are insignificant, but that's also because of the much smaller sample size in that group. So in the talk, I'm going to be focusing on the vaccinated individuals group. This is kind of just also for descriptives. So the share of people who didn't get vaccinated, we asked them to give us reasons why, and we offered them sort of the main reasons we picked up in the literature from before. So people who thought that it was unsafe, unnecessary, that it was developed too fast, that it was not effective enough, maybe there were side effects. And then we also have this other category where people could tell us whatever they wanted. And we also had some, let's say, interesting responses that we wouldn't put in the paper, with conspiracy theories and all sorts of fun things like that. So this is the outcome that we look at.
Excuse me. What is the difference between unsaved and side reaction? What is the difference? Unsafe and side effects.
Yeah, so unsafe would mean something, there are people who have concerns over the long-term safety of vaccines. So they might think, well, we haven't tested them enough, maybe in a year or two, it will cause problems. You have the conspiracy.
Yes, but it's similar to side effects or not?
So side effects are more short-term things. So side effects include having fever for 2 days, headaches. Okay. So lots of people didn't want to get the vaccine because they thought, it's just unpleasant. I need to work. I can't afford to have fever for 2 days, something like that.
Thanks.
Yeah, thanks for the question. So this is our outcome. How likely are you to get the booster shot, or for the unvaccinated group, how likely are you to get the COVID shot? And as you can see, for people, the main predictor for getting a shot is the previous behavior of getting a shot. So if you already got the first vaccine, you're very likely, most respondents say that they're extremely likely to get the booster shot, whereas those who are unvaccinated are extremely unlikely to get any vaccine. Although you see that there's still, some amount of undecided individuals in both cases. So a couple of results to go through. So we also kind of ran an observational part of the study where we asked them lots of questions about their political views and trust, and so on. And here, this is just looking at the observational side, where we do an interaction between kind of existing vaccination status and trust in government. So we look at the two groups and how trust in government might affect their likelihood of getting a vaccine, either a booster or their first vaccine. And what you see is quite interesting, that for the group that's already vaccinated, trust in government actually, and that's the red line, trust in government doesn't produce any effect, mostly because these people are already very, very likely to get another shot, right? So whether you trust in government or not, you're still very likely, 80% likely to get the next shot. However, for the unvaccinated group, trust in government has a huge effect. So for those who don't trust government at all, they're about 30% or a bit less, 25% likely, 20% likely to get any shot at all, whereas that goes up to 60% for those who trust in government. Now, we found this to be very interesting, because this basically means that trust is more important for those who don't get vaccinated for other reasons, right? So you might get vaccinated for many reasons. You want to protect yourself, you want a normal life, and so on. But if you don't want to get vaccinated for these reasons, actually trust in government can be an additional, let's say, moderator, or it can be an additional reason to get vaccinated. So interestingly enough, trust in government is actually more relevant for those who have not yet gotten vaccinated. So then we look at our main treatment effect. So here we just look at whether having the green pass scenario, which is in blue, or not having the green pass scenario, whether that changes your likelihood in the vaccinated group of getting a booster shot. And this is the result for Germany and the UK. So interestingly enough, we get a result for Germany. So if you see the green pass scenario, you're more likely to want to get the vaccine by about 7-8 percentage points. So substantial increase in your probability to get vaccinated. In the UK, we see that it doesn't have an effect. So you're just as likely to get the shot one way or the other. There are many reasons for this that can explain this country difference. We can't pinpoint the exact reason, but there are lots of plausible reasons. One could be actually that in Germany, they already understood what this policy meant because a version of it had been implemented, whereas in the UK, it had not. Another possible explanation is that it's just a ceiling effect. So in the UK, people were much more likely to get vaccinated to begin with. So there was not much, there weren't many more people you could persuade, right? Everyone, everyone who wanted to get vaccinated had gotten, and everyone who was going to get vaccinated would do it. So you don't have many more people to convince. And you can actually see this, that basically what happens is that with the Green Pass policy, you actually get Germans to get to the same level as the British, right? So it makes the difference between, like 78% and 84%. So a ceiling effect can be another reason. But again, this kind of shows that it's really context dependent, and it may have been different in other countries and at different points in time. That's why we place all of this emphasis on the context of the study. So then as I said, we were interested in how this might be moderated by trusted institutions, and we looked at various institutions. But what ended up being most important in this case is trust in the National Health Service, which was in both countries a key kind of component in administering the vaccine. And in the UK, the effect is much smaller, but it's clearer in Germany. And again, we noticed the same thing, that trust really ends up being relevant. The policy ends up being relevant for those who have low trust. So for people who really, really trust the NHS, either in Germany or the UK, there isn't actually much of a difference. It's not a significant difference. So they're just as likely to want to get the booster shot with or without the green pass. But interestingly enough, for those who have very low trust in the National Health Service, then those who get the green pass treatment are substantially more likely to want to get the booster shot. So again, we have a kind of substitution effect. So if the green pass policy isn't the reason to get the shot, then trust in institutions will fill in that gap. And the other way around, if you don't trust, for people who don't trust institutions, they can actually be persuaded by other reasons. And this is also what we were kind of expecting when we went into the study. We thought, who's likely to be affected by the green pass? Well, it's people who otherwise wouldn't get the vaccine, but they're persuaded by these practical reasons, right? Like I can go to work, I can go to a concert hall, I can get my life back to normal, even if I don't trust the National Health Service. So again, trust plays this interesting, let's say, substitution effect. Okay, and so then I move on to the second study that we had about lockdowns and experts. And maybe I'll explain the experimental design by looking at the first figure. And if you want, I have a slide with the exact details of the treatments, but it's very wordy. So I think this might be simpler. So we basically had a very simple design. We had 3 factors: decision maker, which could be the prime minister or an independent health expert; the context of what is happening, either COVID is gradually rising, so there's a gradual rise in infection rates, and we told respondents specifically, so it's a gradual rise in infection rates, hospitals are not overwhelmed, they can cope, everything is fine. And the second scenario is an exponential growth, so COVID cases are growing exponentially. In a few weeks, we'll run out of hospital beds, and the situation is critical. So we wanted to have the two contexts. And lastly, we have the measure. So is it a simple mask mandate, or is it a full lockdown? So the reason for this is that we were primarily interested in the actor. So what we say is, again, we give them a hypothetical scenario. So imagine a few months in the future, a new COVID variant comes, and it produces these effects, either a gradual or an exponential increase. And we were interested in whether the actor who delivers the message is important. So is it important if the prime minister comes and tells you what to do, or if it's an independent health expert? And again, the reasons for this are quite straightforward. You saw that in many countries, you had this task was delegated to an independent health expert. Again, you might think of Anthony Fauci in the US, who was handling all of the communication. Or you might think of other countries where it was more of a seen as a political decision. You know, a politician had to take responsibility, and so the politician would represent this. So we wanted to see whether simply the messenger in this very simple context, if the messenger would make a difference to people's, let's say, view of the policy and compliance with the policy. So here I'm just going to present, let's say, the baseline results, but we also want to go and dig in deeper and look at heterogeneity for groups depending on political ideology and so on. But here I'll just present sort of the simple results, top-line results. So the first thing that we look at where we actually see a large difference is trust in the decision maker to make the right decision. So we ask the respondents as an outcome, do you trust this actor? Do you trust the prime minister to be making the right decision in this case? Do you trust an independent health expert to be making the right decision in this case? And here, and the answer scale is a 5-point scale, as you saw before, so not at all, trusting not at all to a lot. So what you actually see is a quite substantial difference across the different contexts, across the gradual and exponential increase in cases, and pretty much the same for the different policies. So it doesn't matter if you're mandating masks or lockdowns, if the cases are gradual or exponential, on average, respondents trust independent health experts more to be making the correct decision. So it seems that on average in both, and this is putting together our respondents from Germany and the UK, respondents trust health experts more to be doing the right thing. So it seems that they do see these types of measures as being an issue more of expertise rather than being a political decision. This effect actually is one of the only effects that differs between the countries. So this is the same effect that you saw before, but now divided between Germany and the UK. And you actually see that in the UK, there's a bigger gap. So British respondents trust the prime minister less, and they trust the independent health expert much more. And the gap is still significant, but it's considerably lower in Germany. And again, there might be many reasons for this. We can kind of speculate, but this was the time when Boris Johnson was was Prime Minister of the UK. And, you know, if you remember at the time, I think this was before his scandal of having flouted his own rules, but still he was not necessarily the most trust-inspiring figure. So this may account for some of this, but again, it could be any number of reasons, cultural differences and so on between the two countries. The second thing we look at is, yes, go ahead, Rosemary.
Sorry, I just wanted to ask, who was the independent expert or experts in Britain?
So in the experiment, we didn't give a specific name. We literally said an independent health expert that's part of the scientific community.
Because of course, when you say prime minister, they of course think of Boris, but I'd be interested did you gather what was in their mind in the British case when they thought when they could picture, what was their picture of the independent health expert?
It's a good question. Unfortunately, we didn't think of that at the time. We could have asked them what they had in mind. So we don't have that. What we thought, the principle we went with was comparability. So we didn't want to give a specific name. Obviously, as you said, in the case of the prime minister, if we just say the prime minister, they'll have Boris Johnson in mind. But for comparability, then for the independent health expert, we just we left it at that. Somebody that's broadly the scientific community. Gabi?
No, that was, I was wondering if you defined that, because it's a very abstract term, so rather focuses on expertise per se and not on the role of that particular expertise in the policymaking process. Yeah. So if it's like the Robert Koch Institute, an institute that is really counseling and advising the government, or an expert in a public debate television show. So
No,
they,
so yeah,
thank
no,
you.
that's it's a very good question. So we specified that it's an independent health expert from a national research institution, so that it's not just some pundit, but someone and again, we had to use a broad term that applies to both countries. So we said the National Research Institution, but in Germany, we did expect people to think of the Robert Koch Institute. And later so this is the full scenario, but I'll just highlight the relevant part. So when we talk about announcing, we also talked a bit about the process. So for the Prime Minister, we said the Prime Minister based on consultation with cabinet members. And for the independent health expert, we said based on epidemiological modeling. So again, we tried to really get across this idea that, this isn't just some guy coming and giving an opinion. This is, a reputable expert from a research institute using epidemiological modeling. I think there was another question. There was a hand, but then
yes, partially you answered, but I remember in the United States there was an expert like Fauci that is very well known. I'm thinking about England and Germany. If you said in Germany there was the Koch Institute, but there was a person that was on TV many times, and also in UK there is a special person that was on TV all the time, or not?
Yeah, exactly. So they may have thought, I forget the names now, but I know in the German case there was a podcast as well, and this one person was. Maybe Gabi knows.
Yeah, exactly. It's what we previously said. Our brains are permeable, and this is Lotus effect. I actually am contemplating on the names too. So there were 4 different experts. One, the Wiesner, so the president from the Robert Koch Institute, the main institute for infectious diseases, was at a certain point present on a daily basis in messaging and communication on the caseload and on the measures. And then there was the director of the Charité Institute for Virology, I think, who had the podcast, which was a daily podcast. And then there were 2 other experts, one who analyzed, so professors of virology, one who analyzed the outbreak in the west of the country, and one colleague, and I don't know where he was from, that had always a bit of a deviating opinion. And at a certain point, we even had a fight between the experts, but they were very visible, both during the period by name, obviously, you see, and also they by their visual presence.
Yeah, I think those are all really interesting aspects. We were also thinking, I mean, you can complicate this a lot, right, with how you deliver the message and so on. Podcasting versus appearing in front of the podium. Actually, in what we were also thinking, but we couldn't implement it in this survey experiment. But a lot of the times you had both at the same time, right? So you had, the president or the prime minister, and then next to them was a health expert, and they took turns. Maybe each took a bit of it, or they tried to combine legitimacy. So I think that's also an interesting extension of this. But again, for this example, we try to keep it as simple as possible and just look at simply what the headline name would do. Okay, so the second question we asked the respondents then was to evaluate the measures. So given the different context, whether the measure was appropriate, too strict, or not strict enough. And interestingly enough, this doesn't really differ by context. So then I kept the graph simple. So this is an average of the 2 contexts, but the effect is the same. So the effects are sort of relatively small, but they're there. So so when it's an independent health expert announcing the law, the measure, they're more likely to think that it's appropriate. For lockdowns, there's also a difference, but it's not statistically significant. And then interestingly, conversely, when the prime minister announces the measure, respondents are more likely to think that the measure is not strict enough. Again, the effect is larger for masks, but also for lockdowns. We see the same effect. So in a sense, but conversely, we don't see an effect for the measures being too strict. So interestingly enough, there is this different trust that we saw before does translate a bit into how they view the measures as being appropriate. But it seems that it's more driven not by so much by trust in the health expert as much as skepticism of the prime minister, right? So they might think that this is more of a political decision, especially if it's not strict enough. And again, you can think of examples. There were lots of elections during that time, and then governments in Poland, for example, they had an election during the first wave, and then governments relaxed restrictions also as a kind of as a way to gain more popularity, and then there are other examples such as that. So it may be that individuals perceive, let's say, these decisions that they're not strict enough because they might be in the political interest of the prime minister. But again, it's a relatively modest effect. Yeah, go ahead.
Do you have, so this is aggregate both countries, right? Is there a significant difference between the countries in the not strict enough?
No, so in this situation there, it's the same for both. But the only difference between the two countries here was in the trust and the decision maker. All of the others effects are pretty similar, so I'm showing the average.
Okay, thank you.
But yeah, it is interesting. If you think about it, it is interesting that there's this bigger gap in trust in the UK, but it actually doesn't translate so much into visions of the evaluations of the measure. And this kind of plays out with the other two outcome variables that we had, where you actually don't see much of a difference. So we asked individuals whether they thought that the policy was necessary, and we see no effect. Actually, there's a very, very small effect, significant at the 10% level, but it's substantively speaking, it's not a big difference. So irrespective of whether it's a prime minister or an independent health expert, this doesn't change the view of whether the policy is necessary. Obviously, the context and the measure itself is relevant, right? So for gradual increases, there's a much higher share of those thinking that masks are appropriate. Although interestingly enough, for an exponential increase, they still think that masks are more appropriate than lockdowns. But this is not the focus of our study. But interesting, again, what we notice is interesting is that all of this huge difference in trust in the actor doesn't really translate into belief that the policy is necessary or not. And it's even more true for personal compliance. So we asked our respondents, how likely is it that you're going to strictly comply with this policy? So either with the masks or with the lockdown. And it was here, whether it was a prime minister or independent health expert was really irrelevant to whether individuals themselves would comply or not. So what we take from this is, let's say, a little bit of a paradox, where for individuals, it's really important who makes the decision in terms of whether they trust that person to make the right decision, but it doesn't seem to be influencing actual behavior. So whether you comply with the measure or not. So it kind of tells us that there's a bit of a more nuanced role of trust and health experts and politicians. Now, like as I said, these are only the sort of the top line results. What we then want to look at is how political ideology and other factors moderate this relationship. So we actually suspect that, for example, we have a populism scale in our survey, so we suspect that populists would be obviously much more skeptical of health experts and much more likely to view these decisions as decisions that need to be political. And then there are other intervening factors that we want to look at. But yeah, this is what we have so far. So that's what I had to show you. And thanks for your attention and your questions. And I look forward to more questions and feedback.
Great, thank you very much, Alex, for presenting the empirics of it, which indeed, I mean, it's always a bit difficult when it's counterfactual in a way and not what you expected, right? To see, okay, impact on something that I want to ask you something. So saying there's an impact on, it's important who takes the decision. but in the end, that doesn't have any type of impact on my compliance. How did you frame take decision? What was that meant to how communicates the decision? Because in the process, there was obviously political decision making based on the information received from experts.
Yeah.
How did you frame the first question on decision taking?
You mean the outcome question?
Exactly, the very first one. So where you saw a significant difference in between whether it was a politician or an expert.
So we asked them, do you trust this actor? And then we inputted do you trust the prime minister, or do you trust the expert to take the right decision?
To take the right decision. And was there a granular differentiation on the impact of that decision? Because it could be that then the respondents think of political decisions and think of technocracy in a way, because it's different. There, the levels are different of the political levels are different of the decision making that you ask, right?
Yeah, exactly. We did. Let me actually look for the exact question, because I think you're right that it's very important.
How it was framed. Yeah.
Our intention with this was to give people the idea that it was really an independent decision, so it was either a political decision or a public health decision. And of course, as you say, in the real world, politicians had lots of guidance from public health experts, and you also have the situation where it's a political decision, but then they put kind of a public health expert to deliver it.
Yeah.
So I think those are also interesting situations. Here we try to kind of suggest that it's really that person who's making the decision. That's why we included that bit about prime minister in consultation with cabinet members, so to give the idea of a political decision, and a public health expert based on modeling, so to give the idea that this is a purely kind of let's say scientific decision.
Okay, what I'm wondering is the next level, because what this question suggests is that both types of decision taking have an impact on the individual citizen. While if the experts decide that does not translate into a political decision that can lead to a mask mandate or a lockdown. So the level of effectiveness by the questions, by the decision taking of the expert and the politician is a bit different for compliance. You know, because the expert needs a politician to take on that decision,
right,
to transform it into a political decision and regulation. So the immediate impact on the survey, the participants, is a bit lower. So it's a bit buffered. So I can trust a person more easily if I know this decision doesn't have an impact, a direct one on me. If you waited for this direct political impact in the survey.
I'm not sure I'm following. So what
so
exactly?
If you ask, do you trust a prime minister, a political actor, a politician more in taking a decision, or an expert? Both actors take decisions on different levels.
Right. Yeah.
An expert never takes a political decision. So for me, as a subject to political decisions, it might be more easy to trust an expert because it doesn't have a direct impact on me. In that way, I meant it.
Right. I think again, you're right. But we wanted to make this comparable. So we wanted to make it seem as if they did have the possibility to make let's say a political decision, in the sense that the lockdown would go into effect because they announced it. Even though you're right, like this has to be a political decision in a way, but you can imagine a situation where the politician just delegates this, or a politician that would say, I follow the health expert and their modeling, or a politician that says, I consult with my cabinet ministers and decide.
Yeah.
It's a little bit lost.
Do you take what you now said with, you had a lot of open questions, answers with conspiracy theory. Do you take that into your analysis? Because I think it would be important to understand if people interpret it in that technocratic way. Because it can then be It can be rather a reaction to politics than to the actor in the concrete situation.
That's an interesting idea. So we haven't done that yet, but I'll definitely look into the non-vaccinated. So in the meantime, I brought up the exact question. So we asked,
Cool.
to what extent do you agree with the following statement? I trust the actor, so Prime Minister or independent health expert, to implement appropriate measures to contain the virus.
Okay. Which targets the level of expertise and knowledge on the particular disease, in that case, COVID. Yeah, which makes a bit of a difference.
Yeah. So it's again, they trust the independent health expert more to take the appropriate measures.
Yeah.
But they're only a little bit more likely to think that the measure is appropriate if the independent health expert passes it. I think what I would also note is that we could have asked many other questions here to see the impact of trust, because it's not, trust doesn't only impact your compliance, but it can impact, your view of the government and, many other things. Like, surely if you keep trusting a particular actor to take an action, even if you don't change your behavior immediately, it may have other implications.
Yeah, thank you. Giampiero, over to you.
Yes, I have a couple of questions. The first one, maybe it's just an hypothesis. Maybe there is a spurious relation in the sense that probably people trust on media, trust on TV, and so they learn. They were in contact with experts and politicians through TV. If the politicians or if the expert they sold their message in newspaper or in radio, probably few people will listen to it. So I think that behind politicians and behind experts, there is the trust on TV from the people. And the second question is, of course, you did a research in UK and German, but I was thinking about the other country. I mean, UK and German, as far as I know, they trust on the state, okay? If you take, for example, Italy, or if you take East Europe countries, they don't trust. I mean, there is a lower trust on state. So probably, maybe I'm asking you, maybe in that country, they believe much more than on expert than on politician. Why in Germany, UK, expert and politician, they are very close, I mean, in your graphs.
Thank you. I think those are good points. So trust in media and TV as a medium of interaction, I think that's probably true. So this shouldn't really introduce any bias in the analysis, because it's an experimental design. So people with low trust and high trust in the media, they should be equally in the treatment and control group. But I think it can be an interesting moderator. So we do have questions on trust in different institutions, including the media. So we'll definitely try that to see whether the effect is maybe stronger or weaker for those with high trust in media. I'm not sure what your hypothesis would be. Would the effect be stronger or weaker if you trust the media?
I think will be less strong without the TV. So the TV was, I mean, you know that the message is on the media, okay? So the media was an important part of the process of persuading people, much more than politician and expert. Right. But it's just a thought, I mean.
No, and for your second comment, I think you're absolutely correct. So that's why we put a lot of emphasis in the context that we study. So not just the context of where Germany and the UK were at the time, but yes, Germany and the UK are kind of very specific countries. And I absolutely agree. I think in countries with lower trust in government, you may have higher trust in experts, but actually I don't think it's a given. You can have low trust in both in certain countries, especially countries that have more populist tendencies, then you would also have, low trust overall, which would more heavily impact uptake.
Rosemary, did you want to come? Yeah.
So I just want to follow up you say you have a scale on populism, but the thing I was thinking about was the overall political context, because you mentioned Anthony Fauci, for example. And so although I'm from Britain, I've lived for years in the United States. And, at the beginning, Trump was doing everything he possibly could to sideline Fauci. So, what Fauci said at period A, when he was, having to stand in meetings and actually say nothing when Trump was making these preposterous things. I mean, okay, so there may be so populism may capture some of this, but the overall political climate and how it changed, and sometimes in some cases how administrations changed or the nature of the experts changed. I was wondering if you have anything that might capture that. And my second question, and this is only because I'm currently reading you and your colleagues' work on the EU, I was therefore prompted to ask, do you think that in terms of what you were seeing in the UK and Germany, did what was happening at the EU level have any effect on that? What you saw? Do you think it was in any way mediated by or affected by EU measures?
Very, very good points that will not have easy answers. So yeah, that's the problem with having only two countries. It's hard to tease out the effect of context, but I think you're absolutely right. Context is really key. And it's another level of detail that's interesting. So I think you can even interpret Trump's switch in using Fauci as also a way to distance himself from the measures, right? So you might have a public health expert addressing the measures, not just to reach higher compliance, but because you don't want to take responsibility for lockdowns. You don't want to be seen as the one implementing lockdowns. And I think that's also going to impact things. But yeah, so we can't vary the context that much, but we do have these other measures for populist attitudes, education, which party people vote for, and I remember there is a difference in terms of different voters, but we're still working through that. So I think that's the best way we can do that, by looking at different types of voters, different types of political values. In terms of whether the EU had any effect, again, it's not something we can really address directly in the survey, but I can speculate. And one speculation is that it's up to the vaccination campaign as well. So we know overall that so the EU started its vaccination campaign later, partly because of supply issues. So the UK and the US were the first to start. Eventually, the EU caught up, but we know that overall Germany, and this is why we picked Germany as a case, that Germany had an overall lower vaccination rate. And it was actually a phenomenon shared among kind of German-speaking countries. So Austria and Switzerland also had much lower vaccine uptake rates than Italy, France, and so on. And I think definitely the EU level had an impact there. I know that from other work that we've done, that in Germany, people were very dissatisfied with the vaccination campaign compared to other EU countries. This is in a book that's going to come out with Hans-Peter Krysi, Zbigniew Wróblewski, and Iwona Lenawana in Oxford University Press in the next coming months. But we look at this, how satisfaction with EU and national level policy differed between countries. So we know that Germans were particularly dissatisfied with the vaccination campaign. And what we argue there is that it's actually due to the fact that Germany had to delay its vaccination campaign in order to have this EU-wide procurement, right? So Germany it was manufacturing some of the vaccine, and it's a big, rich country. It could have done exactly what the UK did and immediately get doses and vaccinate people. So we argue that this is the reason why Germans are very dissatisfied. So I think this, to get back to your question, I think that if this could be the impact of the EU level at that point. But this is an impact that's specific to Germany. Actually, most other countries in the EU were very satisfied with the EU vaccination common procurement, especially smaller countries. So if you think of the Baltic states, Romania, or any other country that would not have been able to do what the UK or Germany could have done on their own, they were very satisfied. So I think the overall, in the book, we conclude that the overall, let's say, impact of the EU was positive, and people had a very positive reaction. But Germany is actually the only exception in our sample of countries where people were more dissatisfied with the EU. So then I would also speculate that this impacted vaccine uptake if they were dissatisfied.
Great, thanks a lot. Alex, could you run us through the intervening variables again? So through all of the controls that I noted: media, populism, party affiliation, education levels.
Yeah, so these would be moderator variables, not controls. But let me see, I have them in front of me. So these would be the main ones. So political attitudes, left, right, populism. Well, in the observational part of the study, we control for many other things, including whether the respondent had COVID. So we asked them they had COVID, if they're concerned about COVID-19. Let me see. Yeah, then we have kind of the standard, also like economic ideology, cultural ideology, these kinds of things.
Yeah. Okay. Do you plan to disaggregate by gender? Or rather, excuse me, by sex, not by gender, by sex.
Yes. We haven't thought about it, but we could.
That could be an interesting element to see. There seemed to be a bit of a difference in between female and male perception assessment there.
Yeah.
If that can be confirmed, that would be very interesting.
Yeah, that's a good idea. So I wrote that down. We also have a scale for technocracy. So we have a scale for populism, also one for technocracy. So we asked questions like, social problems should be addressed based on scientific evidence, not ideological preferences. Politicians spend their time seeking re-election instead of fixing problems. Only elected officials can make legitimate decisions about public well-being, and things like that. So to see whether views on technocracy, and we expect that is also an important moderator. We also have measures for trust in pharmaceutical companies, research institutes, government, National Health Service.
Yeah. What was the sample? How many people did you ask?
We had about 1,500 in each country.
That's really cool. Will that be a book in the end? Because you said you are working on 2 publications, and it seems a bit, the amount of data that you have offers so much more than 2 publications.
So far, we're thinking of 2 publications. So one on the vaccine, and the one on the vaccination, we try to go deeper into vaccination, the politics of vaccination. So we try to look more into all of these different measures of ideology and so on. And also to see, we have questions for whether they were already vaccinated and whether they want to get a new vaccine. So to see, and these are actually also show some differences.
And what is the timeline? When do you plan to have something out?
We plan to have them out by now, actually, but we've been delayed. So I think, yeah, hopefully in the next couple of months we'll start getting it out. As I said, we originally ran it in September of 2021, so it's already been a while.
Yeah, okay, but data collection, cleaning, everything. When did you have everything at hand? A year after, roundabout.
A few months after.
A month after already. Yeah. It's a really, really rich data set that you have. where you can play around. And when you say publication, it's articles or? Okay.
Turning this into articles, yeah.
Mm.
Yeah, we also ask respondents whether they have children. And so we were interested, and we're still interested, and also the age of the children. Especially for measures such as lockdowns and vaccination, this should also be quite.
Yeah, and the expertise that you had, masks and lockdowns, were medical expertise, right? That's what you were targeting at, because you said, so it was, sorry, virologists' expertise, what you had in mind, not children's psychologists, traumatologists, everything that we had defined ex post as context knowledge that could be good to specify and target social policies then stronger.
Yeah, and epidemiologists is what we had in mind, and again, that's what we included in the wording, epidemiological modeling, to give this.
Yeah.
Okay. Talking about, yeah.
Yeah, great. Do you have any other questions, Rosemary, please?
I think you're muted, Rosemary.
Do you plan to do a follow-up? Like now it's it's a couple of years later. It'd be interesting to see, and many things have changed.
Yeah, that would be a very. We haven't thought about it, but it would be a very good idea, because I mean, I was reading some recent articles that there's lots of pandemic fatigue, and that now, at least this was more specific to the US, that lots of people are very inclined now to think that we overdid it during the pandemic, that there was too much lockdown, too many restrictions. And I think that's very interesting. If you think about lessons for a future pandemic, it almost seems like the wrong lesson, right? that we did too much. But that would be very interesting to run now, because again, we did frame this in terms of hypotheticals. And of course, the hypothetical is much more reasonable at a time when people are experiencing it. Now it's far removed, but it can tell you something. So,
well, especially since right now, of course, bird flu appears to be looming on the horizon, and the great doomsayer of epidemics or pandemics in the United States. Osterholm, he always says, forget COVID. The big one is going to be influenza. And so, who knows, if you time your follow-up right, you might just hit the next pandemic.
Yeah.
And then you can see how fatigued people actually were. Actually, less facetiously, one of the things that I think a lot about, especially, I mean, people got so focused on COVID, and in some of the work on the EU, people think about COVID in the context of prior other types of crises. But I wonder, are there any questions in your studies that ask about reactions to prior epidemics? Because in the last couple of decades, I mean, the first time avian flu came on the scene, I mean, people, even though it never materialized into a pandemic, people were completely panicked. Certainly in the United States, everybody was saying, this is going to be like 1918. And so there has, I mean, nothing has been that bad, but there has been, in the last, I guess, 20 years, there's been a whole lot of different pandemics. And so to some degree, the population has had some priming with regard to illness, pandemics, et cetera, So did you have any questions in your survey that might kind of get at that? This is, in the past, well, whatever, and particularly with regard to governmental measures, for example, around swine flu, as you will know, the WHO was roundly criticized by the EU or the EU Parliament for having exaggerated the extent of the swine flu epidemic, because they then argued that people bought a whole lot of unnecessary, spent thousands of dollars on unnecessary antivirals and vaccines. And then they said, well, I mean, they were much into assigning blame that some members of the WHO had ties to pharmaceutical companies, et cetera, et cetera. But anyway, it's not as though COVID came out of nowhere. So I'd be quite interested in that.
I think it's a really interesting point. We don't have questions like this now, but I think it's an interesting point because I think in the beginning of COVID, you had exactly this dynamic where everyone was saying, oh, it's fear mongering. Look at all these past pandemics, nothing happened. Look at SARS. You know, there was so much hype and swine flu. So it feels almost like a case of, you know, a boy cries wolf, and then we didn't take it very seriously. I think, yeah, it's an interesting point. I wonder if people really have opinions about this. I wonder if people even remember the swine flu, or if, or you know, it feels like bird flus come every once in a while, and I wonder if people have a good sense of what they are. I think their sense of COVID is much clearer because they live through it. But I think it's an interesting question whether we're now more or less sensitive. I don't know. What do you think in terms of the bird flu in the US? Do you think it's being taken more seriously or less seriously than it would have without COVID?
Well, I was thinking a little bit about, you might find a different, I mean, it would be hard to figure out why, but you could look and see if there was a difference by age. You know, when I'm teaching my students, you know, and I talk about AIDS, it's like they weren't born, you know, it means nothing to them, right? It's not a collective memory. But for some of these things, I mean, okay, so you've got avian flu, then you've got swine flu, then you've got Zika, Ebola. It depends a lot. It depends a lot which countries that actually had an effect in. Although in the United States, even though Zika and Ebola, I mean, in the end, they had something like 2 cases of Ebola, but there was this giant, you know, panic. And so you might see a difference in terms of, you know, some of my students do remember swine flu because, you know, yeah, well, then they were quarantined and whatever did their schools do or whatever. So I don't know, you might see something depending on the age range in your cohort, which might be interesting to explore in the future.
No, that's a good point. It's true. Older individuals will have lived through different pandemics, but then there are so many other differences with age that it's hard to attribute a specific thing. I think trust also varies by age.
That's an interesting point that I think would be worth investigating, because I'm not necessarily so with the results of the European Parliament election, and you know, we had this experiment in Germany to lower the voting age to 16, very much promoted by the Social Democrats and the Greens, hoping obviously that this would increase their share of the votes. And a large part of the vote, over 30%, went to Christian Democrats and AfD. So I'm not, and that potentially also inspired by, yes, fear of economic future, but also conspiracy theory and distrust in institutions. That would be interesting to see if this affect age, trust levels can be confirmed in that case. Yeah. I had a different question. Do you plan to, and this might be too normative, but to also work in terms of correlations on looking into what elements are important for trust enhancement? So to find out a bit which works positively for trust enhancement in these situations, because as we started also, and Rosemarie said that for the future, for the next pandemics, how can we preserve this learning from the pandemic?
It's a super interesting question. It's something that I think about because I'm trying to work on an independent project application, a research grant application in looking at trust during times of crisis. And that's exactly one of my questions, you know, the first question is, under what circumstances are populist leaders able to erode trust? And in that situation, actually, COVID would be a negative example. So, you know, with some exceptions, and I think the US is a big exception, but compared to other crises, COVID was kind of particularly difficult for populists to spin because you can't, and to erode trust in institutions, because you can't really blame them for the crisis. If you have an economic crisis, you can blame the central bank, the political elite, the financial sector. With a migrant crisis, you can blame other countries. If you're Orban, you can blame the EU. But in terms of COVID, you can't. It's a virus. You can't really blame anyone. Trump tried to blame China, and he was sticking at it for a while, but it didn't really work because in the end it was their problem as well. Then they really tried to criticize Fauci, and I think that worked to some degree. But in most European countries, it didn't really stick. When you had the Green Pass policies introduced, then lots of far-right politicians started arguing against it from a kind of a freedom point of view. But again, it didn't really stick, at least not, it's clearly not, it was not as effective as they were in other crises where they could really kind of point the blame at existing elites and kind of profit from that and say, the elites are corrupt and you shouldn't trust them. And so then I also wonder if there's something more to COVID than the kind of objective circumstances of, it was just a virus and it was difficult, or whether there was something else that made it difficult for them to erode trust. So that's one question I have, and I'm still thinking through it. And the other one, it's how do you enhance trust? Because it's, I think, quite possible that it's not symmetrical, right? So the things that erode trust are not the same things that enhance trust. So I'm curious to hear your thoughts as well. I would think that it should definitely be linked to performance. So if the institutions perform well, there's all this discussion in the U.S. that lots of voices saying that the Fauci and the public health experts, they were so all over the place in making different recommendations. First they said, and the WHO as well, right? Because for different priorities, they first said, don't use masks, and then use masks, and changing, some of it is you just adapt to the circumstances, but to people it seems like you're flip-flopping. So 2 months ago I had to do this, now I don't have to do this. And so there was all this discussion that this was in a sense a bad performance and people trusted them less. But yeah, I'm curious if you have any thoughts on this.
So that's why I ask, when I ask whether there was disaggregated data for Germany and the UK with this trust in Prime Minister / Chancellor, I was wondering, and for me that was a bit surprising to see that there wasn't a huge difference, because I gut feeling assumption would think that the political leader at the time in Germany was highly trusted because of stability, because not of her policies, but because of trust in her personal qualities, character, and how she steers the process. That was interesting for me, that this personal performance, as you said, didn't seem to have an impact.
It did a little bit. So I think that's one of the reasons why the gap in Germany is smaller than in the UK. Mm. But you're right, you could have expected a wider gap, let's say. Mm.
Yeah. Rosemary.
Yeah, you're still...
Sorry, your mic.
Yes.
Sorry.
So I think also, I mean, it's a really interesting point, Merkel versus whatever. There's a piece by Nick Ziegler, I don't know if you've seen it, it's a very sort of short piece, which is looking at things like, it looked at the UK, the US, and US, UK, and Germany, yes. Early, but the thing is, I think it varied enormously at the beginning of the pandemic. I think he may have I'll have to look it up, but I think he may have written that in maybe 2021 or even earlier. A lot of people wrote stuff in 2020. And he draws a contrast in terms of, well, I guess he would put it the use of science, the way science was kind of used, and points to very, very different reactions in the three countries. And part of it, if I remember correctly, of the German reaction he attributes to Merkel having, what did she have, a PhD in physics or something like that?
Chemistry, I think.
Yeah, whereas Trump, Trump has recommending that people inject themselves with bleach and God knows what else, and that you know, that in that case the character of the leader really mattered. But that's why it's interesting to look at, you know, if one could have a sort of track all the way through the pandemic, and see, well, you know, how long does that actually have an effect? And then when do other things intervene to change the level of people's trusts in government? Because I think it's not a static thing. I mean, that's the thing that's hard if you're studying it, that, you know, trust in government or trust in the health service may look like X at a point, you know, Y, but then you move on and, you know, various things occur, and then suddenly people are like, well, I mean, Sweden's a very good example, right? I mean, people always say, and people were used to accepting pronouncements from the scientific bureaucracy. That's just how they did things, right? And then, well, that didn't work out too well. So then after a while, even though that was kind of baked into the national polity, it didn't hold up, depending on, you know, what then happened to the course of the pandemic. So it's very, I guess I'll say, I was about to say something trite, which is it's very difficult to study pandemics over time, but that one has to kind of bear that in mind, I think, you know, and maybe insert some of what one knows about the history, you know, before the point that one does the study.
Yeah, good. That sounds interesting. Could you send me the paper? I'm not sure.
I will, of course.
Thank you.
Yeah, which could also add to this cultural variable that you introduce, not only as a general political culture, but also the trust in health system and as the, you know, the floor for the acceptance of decisions. That's a very interesting point. Yeah.
Yeah, I think the other thing that made me think of is that trust in a way is not only necessary for compliance, but also for framing the problem, right? So going back to this idea of the boy who cried wolf, and, you know, when is a pandemic? When should you be scared? In a way, you have to listen to an expert, you know, or not, depending on your level of trust, to think, oh, is this something I should really be worried about, or not?
Yeah.
They're the meat eaters of reality. So if you think of the first wave of COVID, you basically had this paradox where many countries, especially some East European countries, they locked down before they had any case, just because they were so convinced that it would come and it would be so difficult. So in a sense, and then they were victims of their own success, because they were predicting a huge rise in cases. They locked down. They didn't have cases in the first wave because of that. And then people thought, oh, we did it for nothing, even though it worked. And then they had large numbers of cases in the second wave. So in the end, I mean, the expert voices that mediate your reality. So did you understand counterfactuals? You know, how do you know that you would have gotten a pandemic if you hadn't stopped it in the beginning? It's a matter of interpreting reality. Or, you know, when Trump was saying that the virus is going to go away in 2 weeks, it's also a matter of interpreting reality and whether you trust.
Yeah. Which in the end is this paradox of intervention, right? That you then see that the cases are not rising. And that was a lot of debate during COVID, that the cases are not rising in the exponential way that you had thought because of the intervention. And yeah. What occurred to me is, it could be interesting, and I don't know, that's a question, if you factored that in your conceptual theoretical framework, to look a bit into politics and uncertainty. So how this also plays out for politicians to take decisions under uncertainty, and how aware citizens are of what that does to the intervention and the flexibility. As you said, Rosemary, it's not a static element, the trust. And which also has an impact, obviously, on the communication, how you communicate this uncertainty around the decision, to make people understand that this is not the ultimate decision, but at this point in time, under these conditions. That could also be interesting if that in the communication, if communicating more around uncertainty has a stronger effect on this trust in the decision making. And there's something very interesting where the two worlds collide, is that what we saw in Germany, that the experts the more independent one that were not necessarily consulting the government, had a different discourse also in talk shows in the public, because they were very open about the uncertainty, as they could be, because it's part of science, while the politicians always avoided to talk about uncertainty, because that's obviously then a sign of less informed decisions in a way. So that's very interesting also to look into that, if the way how politically uncertainty is communicated has an impact. I mean, this is a wish list. Ex post survey always doesn't help, but if you somehow can, through correlation, find something out about that, that's very interesting too.
Yeah, I think that's a very interesting question. I'm sure there's a literature for it out there. How much, I think it's also amount of degree, right? How much uncertainty is useful. And I think, in a sense, that's a part of the mistake that the WHO made in the beginning, and not being transparent. So as far as I understood, their initial recommendation not to use masks was actually because they thought that individuals would use up the supply, and then you wouldn't have enough for healthcare workers. And so they thought, we'll say this, and then later, when there are more masks, we'll recommend it. But it actually, it would have been better if they communicated more clearly from the beginning and said, leave it for the health. It's good, or it's probably good because there was enough evidence, but leave it for the health experts. I think it's the same with other types of uncertainty. But I imagine there's a trade-off, because expressing too much uncertainty, then people will stop believing you, or they'll say you don't know anything. So why should I listen to you?
I mean, it's an interesting point. The IPCC has factored that very much into the reports that they now do. Nearly after every claim, they do this high confidence, low, medium confidence, to make at least policymakers understand the basis of the evidence that informs the report. But I mean, that then relates back to how to communicate complexity and to understand complexity of these decision taking.
Yeah, it's notoriously difficult to communicate these things. I think there's a famous example of JFK being advised on the Bay of Pigs invasion, and apparently the advisor told him that they use some kind of vague word. So I think we're reasonably confident it can work. And so he took it as like, oh, we should do it. And then the expert actually said, no, well, after the fact, he said, no, I meant something like 20%. That's a reasonable. And so, yeah.
Yeah. All going back to the communication level. And on that note, if there are no further questions, we are very much looking forward to the publication. If you want to come back and present a different stage, we're happy to have you back. And for today, thank you very much for
thank you very much.
giving us insights into your research.
It was a very stimulating and interesting discussion.
Absolutely. Thank you so much. And for the rest of you, 4th of July, our final presentation and session for this year, and this will academic year, and this will evolve around quantification and how numbers shape politics, and what normative impact quantification has, especially with a view on modeling the numbers, the invisible numbers of policymaking, what normative aspects and impact that has on societies and politics. With Andrea Saltelli, I should say. Perfect. Thank you very much for today. Thanks for joining us, and I hope to see you then on 4th of July.
Thank you.